Hello, everyone. Thank you for coming to Scope PHA's virtual information session. We're so glad you're here. To give a little bit of an introduction, who are we? We are Scope Patient Health Advocates, a UCLA organization that shadows physicians at UCLA Health and works one-on-one with patients to address unmet social needs. Hi, my name is Danielle, and I am the president of Scope PHA. This is the rest of our executive board: Sean, our internal vice president, Shannon, our external vice president, and Jessica, our resource and development vice president. So to give a little overview of how this is going to work, first we're going to go over what we do in clinic, and then a little bit about our project team system, and then finally our application, which is due this Saturday. And then finally, we're going to break out into breakout rooms where each of the project team directors will be there to answer any questions you have. Okay, so we wanted to start out big picture about our mission. So at its heart, Scope Patient Health Advocates is an organization that's born from this idea of care beyond the clinic. This refers to how factors outside the span of a 30-minute doctor's appointment, for example, where they live, what they eat, and the distance they travel to get medical care, can fundamentally change how their long-term health outcomes are. So, what we're driven by as PHAs is the belief that asking questions about these factors beyond the four walls of the clinic can help us bridge the gap between what happens in the clinic and what happens outside of it, and promote conversations about a different paradigm of care that involves discussions about housing, childcare, transportation, and nutrition, because these day-to-day living circumstances are factors that play an undeniable role in people's health. Okay, so now I'm going to hand it off to Jessica to talk a little bit about our actual clinical shadowing and one-to-one interactions with patients.
Sounds good. So what we do is kind of split in between our work in the clinic and outside of the clinic. So in the clinic, we will be shadowing physicians at Santa Monica Hospital at their medicine pediatrics center, and we will be shadowing physicians in the internal medicine and pediatrics departments. When we first shadow them, we'll walk in with them into the patient's room, kind of listen in to the patient's conversation with the doctor, just kind of take notes about any of their social needs that we may notice. And afterwards, after the doctor leaves the room, we will then talk with the patients and their families one-on-one to talk about any of their care gaps or concerns about accessing care or the quality of care. And so while we talk to them, we will be using iPads that we have in clinic to assess any of their social needs and social determinants of health that can range from mental health, transportation, employment, etc. And afterwards, after a conversation, we will after 1 or 2 weeks, we will then utilize our internal database, which is called MyMaps. It's basically our kind of really big, secure database with a lot of resources for each social needs category. And we'll also use external searches on Google and Yelp to find personalized and local resources for patients that are suitable for their income, for their insurance, for their residential area, etc. And then write a detailed email to each patient who is interested in our service and email that within the next 2 weeks. And so through this service, we're able to build these long-term relationships with patients and kind of assist them with their care beyond the clinic. So now we're going to move on to project teams. We have 7 amazing project teams ranging from resource to finance on this page, and each of the project team directors will be talking about their ideas and their goals for the upcoming year.
Hi, I'm Amber. I'm one of the resource co-directors. Sorry if my background's a little bit loud, but I'll talk about what we do internally. So, like Jessica said, we have this big database called MyMaps where we compile a bunch of community resources that are catered towards low income, or mainly free resources that are in different areas of Los Angeles. And this covers different categories such as transportation, mental health, and nutrition. And after we compile it, our PHAs can use these resources to deliver to patients in clinics. And also when we go to health fairs such as Vituity, or also external collaborations, Resource also works on finding additional resources for those causes.
Hi, my name's Andrew. I'm the other resource co-director. Um, we also, within the resource project team, we also work with a lot of collaborating organizations outside of Scope PHA. Just our goal is to be able to expand the scope of volunteering, no pun intended. And then in the past, we've worked with high schools where we're distributing curriculum. We've gone and done a couple presentations and made some really cool activities, teaching nutrition, things like insurance enrollment for a lot of these high schoolers who, when they graduate, they have concerns about how they're going to access their healthcare. Another really big collab that we have is with Vituity. There's a picture of us going to one of their clinics in Skid Row, kind of in the bottom right. And what we do there is we have a little booth where we have pages of resources that are really local to the area that we can refer people to. So whether that's food distribution centers or their nearest shelter, we're definitely just trying to update the list of resources that we can offer. We also have some exciting projects in the upcoming year where we're going to try to bring resources to the patients themselves. An example of this that we have is getting funding for blood pressure cuffs that we can distribute in clinic because a lot of the times when we're in clinic, a lot of people deal with things like hypertension, but they don't necessarily have the wherewithal to purchase like at-home blood pressure cuffs. And so we want to be able to provide tangible resources in addition to the normal referrals that we offer.
Hi guys, I'm Miran. I'm the outreach director for this year. And so a little bit about the outreach team. We're focused on spreading awareness about Scope's mission and what goes on inside PHA. So we accomplish this through a variety of ways. One big thing that we do is managing our social media. So if you guys haven't already followed our Instagram, I strongly recommend you guys to go check that out. But we also create a lot more formal content as well, such as on our YouTube, where we address things like public health topics of interest. So we can really accomplish this through a variety of mediums as well, be it podcasts, infographics, really whatever members have the creative inclination towards. And then another thing we're focusing on this coming year is taking an internal focus to highlight the work done by different project team committees. So hopefully outreach team members will get the chance to kind of work throughout the organization, collaborate with different committees and highlight our accomplishments and show them to the rest of the world. Yeah, and oh, and one more thing. And then we're also focused on collaborating with different organizations, both on and off campus, to again further our impact.
Hi, so I'm Erica and I'm the community director for this year. So community is definitely a more internally focused project team. Kind of self-explanatory, but our goal is mainly to foster strong interpersonal relationships within PHA. I know the healthcare field can feel like really scary and really daunting, so just having people that you can turn to for guidance or support and just like make fun memories with can be really lovely. And I think we really value that within PHA. So our project team mostly consists of planning events, so some of which are our socials, retreats, and banquets, and senior send-off. We also have study dates and book club to promote health and wellness within Scope PHA, and we record memories of all of these for our internal Instagram. So if you're creative and you enjoy planning and you just want to be further immersed in a community outside of a more professional setting, then this is the project team for you.
Hi, y'all. I'm Grace, and I'm the current health tech director. And basically, health tech works to improve the case working experience for all PHA members, as well as our patients and the physicians we work with in Santa Monica. And so in the past, this sort of looked like assisting members with onboarding when new members join fall class in the fall quarter, building collaborations, and also refining more digital-based tools and resources like researching Bruin Walk to build a course database and like a research lab database for members to look on. But now, in the past couple of years, we've sort of focused to a research-based project team. And so in the past, we've partnered with UCLA Fielding School of Public Health faculty to assist us with our research projects, which we presented at Undergraduate Research Week. And this fall, my plan is to conduct internal investigations using our own de-identified clinic data we've been collecting for years and years through our secure Qualtrics form to ultimately identify service gaps in Santa Monica and improve our own caseworking efficiency. Um, and so I hope to also, again, present this at Undergraduate Research Week and other conferences in spring. And so if you guys join the project team, you guys will get some good research experience, as well as reaching out to faculty in Fielding School of Public Health. And also, I hope to conduct internal clinical reflection sessions, just because in the past, our members haven't had the chance to sort of had a roundtable and discuss what we've seen in clinic with each other. And so I think this is a good new opportunity for you guys to learn from one another and discuss what you guys have seen in clinic and from patients and what you've learned from physicians. So that's just a short recap of health tech. And so if you're interested, you don't need any research experience in the past. You just need a willingness to learn new skills on the fly, and the ability to take initiative. So, yeah.
Hi guys, I'm Sean. I'm the internal vice president. Unfortunately, the member development director could not make it to today's meeting, but I'll just be filling in for her. So, member development is all about supporting the community within PHA by offering professional and academic growth opportunities. So, in the past, we created research and opportunity banks, and we also organized professional workshops, mentorship programs for new PHAs like you and skill development events. I guess member development is very interdisciplinary, so it attracts a lot of diverse applicants. So if you're interested in create like creative arts, um, if you're interested in like graphic design, if you're interested in kind of connecting with maybe healthcare professionals, guest speakers, or alumni, this is the team for you. And we do offer the rest of the club learning and valuable networking opportunities as well. And obviously, with member development, we want to ensure members have very impactful experiences that foster growth beyond caseworking. And by supporting the community, we hope to make Scope better caseworkers by providing that support in our GMs through our project team meetings. Yeah.
Hi, everyone. This is Danielle, the president. Unfortunately, our transitional care director could not make it today, but she did record a little message about what her project team is all about. So I'll play it for you guys.
Hello, my name is Victoria Hank, and I'm the Transitional Care Project Team Director. Sorry I couldn't be here to talk to you directly, but I'll still give you a rundown on what transitional care does. Our project team is primarily focused on helping teens and young adults transition from pediatric to adult care. And this can look like a lot of different things, including switching providers, becoming more comfortable with arranging and going to doctor's appointments alone, navigating insurance, and a ton of other responsibilities that are challenging enough on their own, but get even harder for people who have complex medical histories or don't have the correct support or the right support at the time. We try to alleviate this problem by working with our supervising physicians, Dr. Duan and Dr. Ma, as well as our clinic social worker, Cindy Akin, and the UCLA Internal Medicine and Pediatrics residents. Oftentimes, they'll let us know what their patients have been struggling with and recommend projects for the transitional care team to work on. In the past, this has looked like creating insurance guides and compiling dental resources for special needs patients, which you can find on our website in the QR code, or attending community events. The bottom left photo is actually a photo of me tabling with one of our lovely internal medicine pediatrics residents at the Westside Regional Center's health fair. It was super fun, and I hope to have more opportunities like this for the team when this year as we continue to work with UCLA Internal Medicine Pediatrics, as well as grow our involvement with external organizations such as CRC and local high schools as we grow our presence in the community. Hello, my name is Victoria.
Hi everyone, my name is Karen and I'm this year's finance director. Finance's goal is just to support our club in everything that we aspire to do in the community. So this involves just having the funding to be able to have transportation to go into clinic, to have better tablets in clinic, to support our overall clinic and outer LA experience for us, the doctors that we work with, and the patients. UCLA has a lot of grant opportunities open to its student organizations. So a big part of this committee is just to apply to those and try and secure as much funding as we can. That's a skill that's definitely really valuable to learn, including like professional writing, knowing how to pay attention to certain details and tailor your writing in an effective manner, as well as using that funding to support PHA internally. So one of my major goals this year is to be able to sit down with each project team and really be able to tailor a budget or a finance plan to be able to support everything that they aspire to accomplish. PHA's finance team is fairly new. So a big part is also just to be able to build a secure database just of all the like finance grants and strategies that we've used to better set up our incoming like and future leadership teams for financial success. Um, Overall, finance is can be tedious, but it's great to develop that eye for detail and organizational skills and planning skills that will be really helpful when applying for grants in the future in your research, or just being able to navigate a very complex healthcare path going forward.
Yeah, so before we get into the next slides, I just want to emphasize that Scope PHA really values community. We do realize that no matter how much you align with the mission, no matter how much you love the work that the club does, it is the community that makes people stay. Next slide, please. Yeah, so we do 1 hour biweekly GMs as member dev organizes them. These will be from Wednesdays 7 to 8 p.m. Uh, Pacific Standard Time. But these GMs are mainly for, I guess, academic wellness checks, academic enrichment, and just a space for you guys to kind of reconvene after like a stressful week. That's how I kind of view it as, not just a club event I have to go to. So the if you do have time conflicts, that will be an issue because you will have to attend the entirety of our biweekly GM meetings and our project team meetings and our fall class, which I'll talk about later. But yeah. Yeah, so on the weeks we don't have GMs, we will have project team meetings, and this is where you kind of gather with your project teams and work on the stuff, on the individual missions you guys will go towards. For example, if you're in health tech, you'll be working on the research project that Grace has planned for you guys during this time. But also, you guys could be assigned time outside of these project team meetings because we do only meet bi-weekly, so we have so much time to actually complete our work. Yes. And yeah, for new members, you guys will take a public health and public patient interaction fall training class. And this will offer you guys 2 upper division units under the Social Welfare 195 course. So this training class is divided into 2 topics, public health and patient interaction. So for the public health side, uh, just briefly running down what you guys will learn is just kind of how public health really intersects with the with clinical care and how it affects health in the clinic. Yeah. We'll learn about social determinants of health, and specific topics I want to highlight for this year is street medicine, history of disenfranchisement of underserved communities, and social welfare. And you guys will have some exciting guest speakers as well. And the second part of fall class will be all about patient interaction. So it is a little bit scary for new PHAs to go into clinic and sit down in a doctor's office and talk one-on-one with a patient. But that's what fall class is for. You guys will learn about um, like soft skills, such as motivational interviewing and best practices as well. But yeah, these will be weekly classes every Thursday from 6 to 8 p.m. And you will have to attend the entirety of it as well. And this will start week 2. And yeah, we kind of like to call ourselves the family. I know it's a little corny, but it's sweet. I like it. Everyone likes it. You'll get used to it if you do join. But these are a few pictures we had from last year. Some are socials and some are retreats. So to highlight my favorite social event is the Joshua Tree Retreat. It's towards the center. But during that hike, I think everyone had a lot of fun. I had a lot of fun. But yeah.
All right. So after hearing a lot about us, you might be wondering how to apply and how to join. So our application is due this Saturday by 11:59 p.m. So we're just going to cover a bit about the application and what we're looking for. All right, so we are looking for applicants who are first passionate about public health, passionate about health equity. We'd love to hear more about what drew you to public health, why your interests lie in it, any of the communities you're interested in serving, any of the topics that you hope to further explore in the club. And we're all hoping to further explore that through fall class for the new members. We're also looking for applicants who are empathetic. A large part of our work in the clinic is talking one-on-one with patients, and sometimes they will share some more sensitive issues or things that maybe you just, it would be good to have a listening ear and to connect with them. And so these applicants should be empathetic and should be able to relate to these patients and be able to offer that support when needed. And we are also looking for people who are committed. As Sean reviewed, we do have weekly GMs and PMs, which are Wednesdays, 7 to 8 p.m., as well as fall class for new members, 6 to 8 p.m. So being present for the entirety of those sessions is necessary, and also being committed to the patients that we serve. We do have deadlines to email the patients within 2 weeks after our shift, just to ensure continuity of care and ensure timely delivery of resources. And so you should be committed to our mission and willing to kind of search up organizations that would be most useful for patients. Maybe not recommend those that are closed or have full waiting lists, but going out of your way to call up more organizations that might be open, might be more useful for patients' income and insurance, etc. Okay, so we are not looking for people who are not team players. As PHAs, we work a lot with one another in project teams and also in general, but we also work with the patients, with the nurses, and also with the physicians and residents at Santa Monica. So we do focus on providing a supportive and inclusive community and truly being each other's cheerleaders. And we also don't require any prior experience. It is nice to have, but you're not expected to have any caseworking experience or any shadowing or volunteering experience. That's what fall class is for, and that's what being a PHA is for. And we are also finally not looking for any GPA. I guess we offer very holistic review applications, so GPA is not considered. Okay, so to summarize, we offer all of these and more. But first of all, we offer social caseworking, which just means being able to talk with patients and explore their social needs through our intake form and try to understand their barriers to care. And we also offer public health education and professional development, mainly through our member development committee and also our general meetings, having those guest speaker panels, having those guest speakers during fall class, etc. And finally, I guess last but not least, both clinical volunteering experience and family. So we offer both shadowing and patient clinical work experience. And so it's kind of two in one and very meaningful, not to just shadow, but also to explore and go with patients in the long term. And yeah, our community, as always, is essential.
Hi, everyone. My name is Shannon. I am the External Vice President for this year. And just to kind of reiterate what Jessica was saying earlier, our application is very early. It will be due this Saturday at 11:59 p.m. So we are very, very much looking forward to reading your written application. And then interviews will be conducted next week. And then we also just want to hammer a few things that you guys should keep in mind, which is the 50-hour UCLA health requirement. We do start onboarding in the middle of fall class, so starting in October. So if you are currently onboarding or involved in another UCLA health volunteering opportunity or lab, please make sure you complete your 50 hours before October 1st, before you start the onboarding process with us. This is a firm requirement that we will need you to abide by. If you have additional questions, we will have breakout rooms later, so feel free to ask us, but this is something that we do hold true for all applicants. And also, I know Sean has gone into depth about fall class, but this is a mandatory 10-week upper div credit course. It's just really important to kind of give everyone a brief on what public health is, give you more information about what we do as PHAs, and obviously also teach you all about caseworking and going into clinic. And there's just some really great guest speakers as well. It'll be a lot of fun, and you'll learn lots through fall class. All right. And applications are already open. They have been open for a little bit. And it's open to all years, all majors. Even if you're graduated, we welcome you to apply. You can find it in our link tree, in our Instagram bio, and also at this link. Again, it will be due this Saturday at 11:59 p.m. And we are also very active on our Instagram, so please follow us if you want to keep up with updates. Our website is also there, and we also have coffee chats tomorrow. So it's going to be very casual. Feel free to come. There's no like formal dress attire or any dress attire for that matter. We'll just have you come and you can RSVP just so we can get a head count. And we'll just have different stations where you guys can come around and talk to individual project team directors that you might be more interested in. You're welcome to stay from 4 to 7, or you can hop in and out at any time. And that'll be at NRB 132. So we look forward to seeing you guys there.
Okay, that was the end of our presentation section. And so now we'll be transitioning on to breakout rooms where you guys will have the chance to ask any questions about any of the project teams or the application itself or the fall class or working in clinic, any of those things.